Welcome to Yoga Therapy for Health and Healing, a daily practice. The word yoga is derived from the Sanskrit word yog, means union of body, mind and spirit. In yoga practice, the health is defined as a balance and union of body, mind and spirit. The Sanskrit name of health is Shasthu. Sha is self, stha, sthir, stillness. Stillness of the body, mind and spirit is health. Normally, in a day-to-day practice, my body, mind and spirit remain separated. A practice of yoga puts them together, makes them still. So I act as a functional human being. This stillness of the body, mind and spirit awakens the doctor within me, brings self-realization. Self-realization means real eyes. Start looking inside me, introspection. Find out that all the lifestyle-related disorders like diabetes, hypertension, heart disease, which we call non-communicable diseases, that I am the cause and I am the cure. Metaphorically, in cyber language, the body is like a hardware, mind is a software, and spirit is a programmer. And I am the programmer. I program my mind to control my physical body. In conventional medicine, health is the absence of a disease. In yoga therapy, disease is the absence of vibrant health. Yoga is a philosophy. It's called Yoga Sutra of Patanjali. 196 sutras called small aphorisms, primarily to control the mind. It also a practice called Patanjali Ashtanga Yoga. 8 limbs of stepwise practice to bring self-realization, going beyond the physical body. During this practice, it was infused with mudras called hand gestures, health in your hand. Bandhas, the spiritual lock, controlling the life force called prana shakti. Kriyas, cleansing the physical bodies. Acupressure, pressure point or marma point in your hands and the feet, guiding the prana, the life force, to the organ of healing, causing pranic healing. It also incorporated the philosophy of Ayurveda, the science of longevity, especially its dinocharya or a daily routine, and combining all of them, providing a health benefit called yoga chikitsa or yoga therapy. A practice of yoga first will cause rogir chikitsa, control of the disease, secondary prevention or therapeutic medicine. Then it causes shastha, maintenance of health, primary prevention or preventive medicine. It is also very helpful for rehabilitation of the chronic diseases, with better control of the disease, reduction of the pharmaceutical support, and better quality of life. Yoga therapy is an adaptation of these yoga practices for people with chronic diseases. In addition to providing health, which we only can earn, we cannot buy, and healing, called restoration of homeostasis. Yoga practice also provides wellness, physical, mental, and spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Yoga therapy works through our emotional brain called limbic system and its nuclei, amygdala, which responds to fear, and hippocampus, which generates memory. They send a signal through neurotransmitter to hypothalamus to cause homeostasis. The supraoptic and paraventricular nuclei of the hypothalamus then sends a signal through neurotransmitter to autonomic nervous system and the pituitary gland. Autonomic nervous system reduces the sympathetic tone, the fright and flight response, and increases parasympathetic tone, the calm and digest response. It also helps quick shift from sympathetic to parasympathetic tone. Pituitary gland, through its adrenal axis, corrects all the altered hormonal homeostasis. The primary effect of yoga therapy is through meditation. Meditation is the seventh limb of the practice. It tames the limbic system. It quiets down the mind, called chitta vritti nirodha, controlling the chattering of the mind, which is definition of yoga. At a time, my mind has thousands and thousands of thought processes. Majority of them are in the past, most of them are in the future, very few at the present. Those thoughts in the present are also repeat thought process called chattering of the mind. Meditation enters in between the thought process called the gap. It widens the gap. Slowly and slowly, all the thoughts becoming in a file and a folder, and mind quiets down. To be in the state of meditation, the physical body needs to be relaxed. Able to, in a asana pose for a long period of time with all the stages of asanas. Beginning of the asana is arambho, when the muscle contracts. Staying there for some time is called sthiti, stability. Before muscle starts to relax, it enters into a state of fasciculation, twitching, finally called your visarjan, profound relaxation of the physical body. At this stage, it is called sthiram sukham asanam. Sthir is the stillness, sukham is the happy, asana is the pose. When the body is relaxed, the channels which carrying the air in the lung, called bronchioles, they also relaxes. They have smooth muscles in the wall, able to take a effortless, big, deep breath in, which is 3 steps breathing called dirgha shas, exhalation longer than inhalation. 1 hour of daily practice of yoga therapy will cause all the therapeutic benefits. Out of 1 hour, we recommend 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. In this practice, we are going to show you longer than 25 minutes of asanas, so you can practice different asanas for the different days. But for pranayama and meditation, you should do the same set of pranayamas, meditation for a daily practice. To start with, first you'll be able to sit down with your spine straight. Like if you sit in a chair, like you sit in the front of the chair, you go all the way to the back, keep your spine straight, and then touch your index finger and a thumb, close your eyes, and enter into a state of profound relaxation. First, you start the relaxation of the physical body. You sit down with your spine straight. If you sit down with your cross-legged, first put down both of your feet under your knees, cross in the middle, keep your spine straight. If you're sitting in a chair, sit down in the front of the chair, slide all the way to the back, keep your spine straight. Practice this all the time, 24/7. Normally, my skeleton is going to fall in the front. All the muscles in the back contracts, keeps me in an upright position. Able to keep my spine straight brings the relaxation of all the muscles in the back. Next, when I talk, my hand moves before my tongue. Hand is connected to my mind. So to quiet down the mind, I touch the tip of the index finger and the thumb and gently put over my knees. In yogic practice, this is called a mudra, dhyana mudra, meditation gesture. All the five senses, I see, I hear, I smell, I taste, and I touch, keeps me awake, alert, and conscious. Able to close my senses, primarily my vision, brings the relaxation. So close my eyes. So spine straight, hand mudra, closing my eyes. Fourth component is the healing power of breath. Lung is like a balloon. It has 4-liter capacity called vital capacity. We only breathe 500 cc in each breathing. 3.5 liter of carbon dioxide and other gases are sitting in the lung. We learn how to breathe out longer than breathing in. The first, visualize your breath. Air is coming through your nose. It is getting filtered. It is getting humidified. Nose is like your personal air conditioner. If outside air is warm, it's going to make it cool. If outside air is cold, it is going to warm it up. Air gets directed through an organ in the back of your nose called turbinates. It goes behind your throat, going to the main channel of the lung called trachea, starts branching called bronchioles. It divides about 23 to 25 times. Finally, it reaches the sac of the lung called alveoli. The lower part of the lung almost extends down to your belly button. Visualize your breath at the level of your belly button. Just hold it for a few seconds. Visualize the breath is coming out the same direction it went in. Breath is the carrier of prana, the life force. Prana is a subtle energy which keeps us conscious, keeps us alive. Breath is the carrier of prana. Metaphorically, prana is like an electricity and breath is like electric cable. Also, you visualize that you inhale all the positive emotions and exhale all the negative emotions. Once you are relaxed, your breath becomes effortless, you'll start a yogic breathing. In a yogic breathing, you breathe out first. Breathe in effortlessly, actively. Lung is all full. Now you breathe out passively. Exhalation longer than inhalation. In a normal daily practice, you will do this practice between 5 to 10 times, completely quiet, silent, closing your eyes. Inhalation is active but effortless. Exhalation is passive, longer than inhalation. If you keep on doing it for a while, you will see that there is an activation of parasympathetic tone. Inhalation is sympathetic, exhalation is parasympathetic. You will have some saliva in your mouth. When you became stressed, fearful, sympathetic activation, mouth gets dry. In parasympathetic activation, in relaxation, the glands on the side called parotid gland, which is supplied by parasympathetic nerve, starts to secrete. Slowly, you will see your physical body starts to relax. Once it relaxes, you can progress. In stages, impossible become possible. You take your heel all the way to the back, take your foot in the top, your just knees just drops down. This is called Siddhasana. You have to look for your body's signal. First is pain. If it causes pain, you back off. Back off to the point where you feel little discomfort. We call it comfortable discomfort. Stay in the pose with your breathing out longer than breathing in. Slowly and slowly we'll see this is going to happen. You don't push it down. If you push it down, it's going to recoil back. So slowly and slowly it goes down. This is called Siddhasana, perfect pose. And yogic tradition will say, in stages, impossible become possible. Next we'll go and progress, put your feet in the top. This is called half lotus or swastika asana. Slowly and slowly, this is going to go down. You have no pain and you have an effortless breathing. In yogic tradition, any imbalance you create in the physical body, called annamaya kosha, it shows up in your breath. Your breath becomes effort. So once you have an effortless breathing, no pain, you progress and finally you do what is called your lotus pose, Padmasana. Here your feet is facing on both sides, your knees relax, hip relax, back relax. You are in a powerful relaxation response. So the components are spine straight, hand mudra called gesture, dhana mudra, eyes closed, effortless breathing out longer than breathing in, and final component is your vibration. Our brain is in a state of vibration, and yoga gave us the sound of Om. Om has a frequency, same frequency as the frequency of your brain. Two frequency interacts, principle of physics called harmonic resonance. The vibration goes away and your mind and brain quiets down. In a yogic tradition, the Om sound is pronounced with the exhalation. You breathe out first, take a deep breath in, Then the Om sound has three components. A-U-M. A-U-Ma. When you breathe out, you do Akar or A from the lower part of the lung, Ukar or U from the middle part of the lung, Makar or M from the upper part of the lung. And let's demonstrate one time how to do the yogic Om chanting. So close your eyes, keep your spine straight, touch your index finger and a thumb, breathe out first, take a deep breath in, slowly bring your hands together. Keep on rubbing your hands. This is very good yogic gesture. When you keep rubbing, you have the heat in both the hands. Once the hand is nice and warm, you put the hand like a cup over your eyes. Let the eyes take all the heat from your hands, and you feel a profound relaxation. Massage your forehead, massage your eyes, massage your face and head and neck. This is called palming and cupping. It is a very good, powerful relaxer for your eyes and head and neck. Improve your eyesight. What it does, it relaxes the muscles holding the lens, called ciliary muscles. The lens has a better curvature. The reading glasses goes away. Also the globe of the eye, which is softer, it changes its diameter, so it improves your vision. From now, we'll start relaxing our smaller joints. We start relaxing from your periphery to the center, like smaller joints to the bigger joints. First, we start with our hand. If you see an infant, how the infant closes the hand, that's the way the hand gets relaxed. In Sanskrit, it's called Bala Mushti Mudra. Bala is the infant, Mushti is the fist. They will take a thumb, put a thumb inside and close. Once you keep on doing it, the hand gets relaxed. In fact, in the practice, we first do with your breathing. Put your hands up in front, take a deep breath in and breathe out. Do this Balo Mushti Mudra. This is also called the Adhi Mudra. So breathe in, breathe out. This will relax your hand. For the wrist, the extension of the wrist is relaxation and flexion of the wrist is a tightening. So you practice relaxation of the wrist with your breathing. You breathe in, put your hands in extension, breathe out, put your hands down. In a daily practice, you need to do few times breathing in and breathing out. You also can test the extension of your wrist. You can put your hands like this. You can close your eyes and do your breathing out longer than breathing in, and slowly you will see hand is going to come down, get it totally an extension. When the hand comes down in this position, most of the pain in the wrist will go away. Carpal tunnel, other arthritis. The pain is due to tightness of the ligaments and the muscles. Bone doesn't cause a pain. There is no pain fiber in the bones. So the ligaments get relaxed, muscle get relaxed. Next we come to the elbow and the shoulder. The external rotation causes tightness of the elbow and also pain. Tennis elbow is from external rotation. So you want to rotate your elbow, called internal rotation. For the shoulder, raising your hands way high up also causes your pain and tightness. Adduction, putting it close to your hand, improves relaxation. So what do? We put a prayer pose in the hands in the front, then slowly and slowly we do the prayer pose in the back. Put our hands in the back and turn my hand, and slowly the prayer pose goes up and stays in this position. For the elbow and the shoulder relaxation, you do the prayer pose to the back, called Paschim Namaskar. The way you do it, let me show you, turning myself. So here, you put your hands together, then put it in a prayer pose and slowly slide it up. You are only looking for pain and effortless breathing. Once you come to this pose, you stay here effortlessly as long as you can. Initially the muscle contracts to put you in this pose. Slowly and slowly the muscle and ligaments will relax, and all the pain in the elbow and the shoulder will go away. These are called stages of poses, asanas. Arambha is the beginning, sthiti is a stability, visarjan is a profound relaxation. Then you start doing for the shoulder. For the shoulder, what you do, you just rest your hands, you visualize with your eyes closed that you have a pencil in your shoulder, and with the breathing you are making a big circle or drawing a circle. You breathe in the middle, breathe out, slowly rotate your shoulder to draw a circle for relaxation of your shoulder. Shoulder is a ball and socket joint, and it relaxes more when you move it all around in a circular fashion. With your breathing, you can also do backwards. You breathe in the middle, breathe out, slowly move it backwards, making a circular motion. And just continue a few times until you have any effort in your breathing. You also can put your hand on the shoulder and put your elbows together and breathe in, make a little big circle from your shoulder. This movement will relax your shoulder joint. Just for a practice, for a daily practice, you need to continue a little longer period of time. You also can do backwards. Breathe in, rotate backwards. This is the technique I'm showing, but you have to follow with your breath. You breathe in the middle, breathe out completely when you make a circular motion. You can also hold your wrist on the top. You breathe in, breathe out, slowly pull it down behind your head down, then bring it up in the middle. You can your eyes closed and follow with your breath. You progress and you relax very quickly. Breathe in the middle, breathe out, slowly pull it down and bring it back in the middle. Neck is the area which is very tight. You need to learn how to relax your neck. This is called Brahma Mudra. Brahma, name of the Supreme Being. Mudra is a gesture. 4 positions. Keep your spine straight. Touch your index finger and a thumb. Close your eyes. Breathe in. Put your neck to the back. And breathe out. Slowly put your neck in the front. Always bring your awareness for pain and effortless breathing. If there is a pain, you back off. If you cannot breathe properly, you back off. But stay in the pose so you can progress slowly and slowly. In stages, impossible become possible. Breathe in to the back. Breathe out, put your neck in the front. Second position, you start from the middle, breathe in the middle, drop your neck on one side, and the same breathing cycle, bring it to the middle. Breathe in the middle, breathe out, slowly drop in one side, and same breathing cycle, come back in the middle. Third, you breathe in the middle, look all the way to the back without turning your shoulder. You will be able to see at the middle of your back. Same exhalation, you come back in the middle. To the opposite side, breathe in the middle, breathe out, look all the way to the back without turning your shoulder. Finally, you rotate your neck, drop your head down, take a deep breath in, and slowly turn your head to the left, to the back, to the right, and the front. Do it your breathing. Breathe in the middle, slowly turn your neck to the left, to the back, to the right, and the front. You can do from opposite side. Breathe in here in the middle, breathe out, start from the right side. Right side, to the back, to the left, and in the front. This will cause little bit altered sense of consciousness. It causes compression of the 2 blood vessels on the side of the neck called vertebral arteries. Vertebro-basilar insufficiency. Try not to do this standing up. Always try to do this sitting down. You can do this sitting down in a chair. This will cause a profound relaxation of your neck and then profound relaxation of your physical body. For the lower back, we do call a Yoga Mudra. You hold your left wrist to the back, you look straight in front, take a deep breath in, and slowly drop your body down as far down it will go. You are listening to your body's signal, no pain, and effortless breathing. If your body comes down, it will come down with the relaxation of all the muscles in the back. If your head comes all the way down, keep your spine straight. First, your nose and chin will touch the ground. Then slowly and slowly, your forehead will come and touch the ground. Once you are in this position, stay in this position, continue your effortless breathing out longer than breathing in. If you can keep on talking in a pose like what I am doing, you are essentially doing an effortless breathing.
So stay here at least 5 to 10 breaths in a daily practice. Then when you get up slowly. We call one vertebra at a time. You can also come down maybe about halfway and take a little pause and slowly come back to your upright position. Close your eyes and again sit down with your spine straight. Next we'll do relaxation of our lower part of the body. Now we'll show you how to relax the lower part of the body. First, you sit down, call it Dandasana. You put your feet in the front, hands on both sides, and your spine is straight. You are like a L shape. For the feet, relaxation will start from your toes. You separate your toes. And then you take a deep breath in and bend your toes down. This is called Pada Mushtika Asana. Pada means feet, Mushtika means fist. You make a fist out of your feet. Most of the pain in the foot, like plantar fasciitis, bunion, hammer toes, they will go away when you're able to separate your toes. Market is full of it. There are yoga toes, yoga socks, yoga shoes, but primary component is separation of the toes. Ankle joint is very important. The relaxation of the ankle joint gives you your physical independence. Do it your breathing. Breathe in and then breathe out. You breathe in. Breathe out. Slowly you rotate. Breathe in, rotate your ankle slowly, but do it your breathing. As long as you progress with your breathing, the relaxation takes place very quickly and rapidly. In stages, impossible become possible. Doing it opposite side, remember, the health is a balance. So going against the grain of your habits, using the half of the brain which is not being used properly, creates a health. Health is the balance of your body, mind and spirit. For the lower part again, you do called grinding. Chakki Chalan Asana. You breathe in, keep your elbows straight, slowly go down as far as your body will allow and come back higher. Do it your breathing. Breathe in and breathe out. Try not to bend your elbows and do it few times on this side and also do other side. In a daily practice, you keep on doing until you have an effort in breathing. Your breath is your guide for your practice. Relaxation of the knees and hips starts with putting your feet in the top of your thigh. I use my hands, use my fingers to separate my toes. I put it in between my toes, and normally when I'm relaxed, it goes in and out so easily. When you first start, it will be very tight. Then when you relax, you can see the knee and the hip will relax. Knee will come high up. Breathe in. Slowly it will come down on its own. You don't push it down. If you push it down, what happens? It will recoil back. Keep on breathing. Breathing out longer than breathing in. And this is going to happen. Yoga is a mind-body practice. Knee is the site of fear. And hip is a site of emotion. Stress is fear of unknown. When you're able to relax your knee joints, your stress goes away. Relaxation of the knee is a stress management. Relaxation of the hip controls your emotions. Also, you do both sides as a balance. Take your other foot in the top. Take your fingers of the hand, put in between your toes, separate your toes. You can always also relax your ankle joint. Same way, you can take your knees way high up and knees will slowly come down. So the emotion-related disorders today, primary disease is a hypertension. We call it white coat hypertension. You go to see the doctor's office, the blood pressure goes up. Emotion-related blood pressure. The hip relaxation is very good for controlling hypertension. Neuropsychiatric disorders, the disorders of the psychiatric disease and also neurological system is better managed with relaxation of the hip joint. That is achieved through called a Bandha Konasana or called Titli Asana, butterfly. Put your feet together like a cobbler pose, then slowly bring it close to you. When it comes very close, clasp your hands, put it underneath, and slowly you move your knees, call it a butterfly. You don't have to do too high or too low. Gently close your eyes, keep your spine straight, and slowly you will see your knees are coming down and touching the ground. This is the relaxation of the hip joint. For the lower part of the body, complete relaxation, yoga gave us an asana called squatting pose or malasana. You sit down with your feet and able to sit down in a squatting pose. Look at what is happening here. My whole hamstring muscle is relaxed. Knees are relaxed, hips are relaxed. I'm in a profound sense of relaxation. I incorporate relaxation of the upper part. Put my hands, separate my fingers. It causes the relaxation of my hands. I do the extension of my wrist. It is relaxation of my wrist. I take my elbow, put inside this knee, other elbow inside the other knee. Slowly and slowly, I bring them close to me. Now, my whole upper part of the body is relaxed, lower part of the body is relaxed. Keep my spine straight, close my eyes. I breathe out longer than breathing in. What is happening here? The channels which carries the air in my lung, called bronchioles, they also open up, they also relax because their walls are made of smooth muscles. I take a deep breath in, which is called a dirgha shas, 3 steps breathing, and then I breathe out longer than breathing in. I'm in a profound state of relaxation. From here, we test a sign of my health. Sign of my health is called sit, rise test. Able to get up without a support from this position gives us my physical independence. Yoga practice is a balance. We are comfortable standing like this. So yoga practice says, put your feet together. Separate your toes. Also, to balance both sides of the brain, to see if you can do sit, rise test with your feet crossed. Like you cross your feet, see if you can sit down. You can sit down and you get up without a support. That's a balancing both sides of your brain, and also it is a sign of health. Do the opposite side. Crossing again, see if you can sit down, crossing your feet, and get up without any support. Then put your feet together, separate your toes, and keep in a mountain pose, Tadasana. Your ear, your shoulder, your hips, and the ankle in the same line.
So keep your spine straight. Very good for your low back pain, hip pain, knee pain. Then you can put your hands all the way high up. This is mountain pose. First thing in the morning, you do this. Keep your eyes closed. Do the yogic breathing, breathing out longer than breathing in. Next you do upward mountain pose, Utthito Tadasana. Clasp your hands, put it over your head, take a deep breath in, breathe out, slowly get into tippy toes and the hand goes way high up. Then it slowly comes down. This is one of the asanas of intestinal cleansing called Shankha Prakshalan. Next one is oblique mountain pose. Your hands high up here, breathe in, breathe out, slowly go to one side, and same breathing cycle, come back in the middle. Breathe in the middle, go to the other side, and be sure you are doing exhaling, and same breathing cycle, come back in the middle. Third position called Koti Chakra Asana, west rotation. Separate your feet and with hands on both sides, put your left hand to the back, right hand over your left shoulder. Take a deep breath in and slowly turn your body towards the left side, all the way to the back. And same breathing cycle, come back in the middle. To the other side, hands on both sides, right hand goes to the back, left hand over your right shoulder. Take a deep breath in, breathe out, slowly go all the way to the back, and same breathing cycle, come back in the middle. This is also done in a moving meditation. We take a deep breath in, keep my eyes closed, breathing out, slowly go all the way to the back. I'm looking at my hands with my eyes closed. This is called my awareness, proprioception, and I do with my breathing. Breathe in the middle, breathe out all the way to the back. This brings the awareness quite down to the mind, to the point we call it like a moving meditation. Next important standing poses are called balancing poses and chest opening poses. What do? We look at the back, put my hand and then do the prayer pose to the back. Paschim Namaskar. Stay in this pose little longer. Then balance my other half of the brain. I am right-handed, right-footed. See if I can balance myself on the left foot. So I stay on my left foot and as long as I can. Normally, all the studies showed if you can stand on one foot more than 20 seconds to 60 seconds, you are in perfect health. Balance is also maintained with your vision, with your inner ear and your proprioception. So when you can shut down one of those senses, your mind quiets down more. So you practice this balancing pose with the eyes closed. If you can do with the eyes closed, then you can see you quiets down your mind. At this moment, your blood pressure is down, heart rate is down, blood sugar is down, all the parameter comes down.
Again, yoga practices a balance. You stand on your right foot. See if you can balance on the opposite foot. Once you can balance, close your eyes if you can do it. In this position, my eyes are closed. I'm in a balancing pose, chest opening pose. My mind is completely quiet. Sometimes you get a little bit of off balance, but it is entirely normal. The balance will slowly and slowly come back with your eyes closed. You can also do chest opening poses in few other ways. One is called Paschim Bandha Hastasana. You hold your one arm, take the other arm, put in the top and hold the opposite arm. Again, to make the balance, do the opposite way. Hold the right arm, right hand goes over and holds the left arm. Also you can do called Dandayaman Gomukhasana, standing cow face. Take your right hand, put it in the middle of your back, take the left hand, put it down, you hook it, essentially you handshake each other and relax your upper part of the body and the chest. Again, to bring the balance, do the opposite side. What you will notice that one side is easier than the other side, that is our imbalance. When you can do both sides equally and in a balance, our body and both half of the brain is in balance. So again, we bring back the balancing poses. Most important balancing pose is your tree pose, Prakashana. Take your one foot, right foot against your left thigh. Put both the hands high up and stay up in a balancing pose. Very important, quiets down your mind. Do it in the opposite side. Take your left foot, put it against your right thigh. Both the hand goes way high up and you stay in this pose. Longer and longer you can stay, better and better your health going to be. Root cause of disease in your mind. This is quieting down your mind. Dancer's pose, Natarajasana. You take your left foot, hold it, right hand goes high up, drops it down, and slowly other foot goes high up. And you're able to stay in this pose for a little longer time. Same thing will happen to the opposite side. You hold on to your right foot, left hand goes high up, you drop it down, other foot is good. It is how long you can stay in the pose that gives you a better quality of health. The warrior pose that gives you more grounding and your balancing poses. Take your right foot to the back, turn it, left knee is straight, slowly bend your left knee, it stays above your ankle. Put your hands in front, raise your hands high up. Then warrior two, hands goes on both sides, then it turns parallel to your body and you look into your left hand. In a warrior three, you put your hands on the side, raise your other foot high up, drop it down in front and balance yourself. In a regular practice, you also do the same with the opposite side. Now, another way of balancing yourself is holding your toes, keeping it straight and hands high up. You can do also on both sides. Hold the
left toes, keep it straight. Pada Angushta Asana. And slowly drop it down. Triangle pose is very important. We say 1 triangle a day, keep the doctors away. You can do it in the mat. Maybe you can turn yourself on the side and turn your right foot out. Put your hands on both sides. Put your right hand to the right knee and take a look in your left hand and slowly put your body down and able to stay in this pose. You do it on one side and again come up to the opposite side. The right foot in, left foot out. Hands on both sides. Left hand touches your left knee and look into your hand and other hand keeps on coming down. It massages all the internal organs, relaxes your muscles of the back and the side, and it is such an important asana we want you to do for a daily practice. Slowly you get up. Put your hands down and turn your right foot out. Come back to the front of the mat. We'll do a set of sun salutation and balance with the moon salutation. Sun salutation, generally we do it in pairs, 2, 4, 6. I will show you one set of sun salutation and one set of moon salutation. Sun salutation is a 12 steps with your breathing. Put your hands in the front, Pranayama. Breathe out. Breathe in, hand goes all the way high up and to the back, and slowly go back to the back and breathe in. Hasta Uttanasana, hand raising pose. Breathe out, slowly come down, and for a yoga therapy practice, we like you not to do unsupported forward bend. So slowly bend down with supporting your hands, and then when hand can come down all the way, breathe in. Take your right foot to the back, left knee comes in the front, chest opens up, look high up. Asana, horse riding pose. Breathe out, left foot goes to the back, heel on the ground, you look at your belly button, Parvatasana. Breathe in, your knee goes to the mat, your chin comes to the mat, Ashtanga Namaskar, 8 limb salutation. Then whole body comes to the mat. Breathe out, get up into a cobra pose, Bhujangasana, and breathe in, go back to mountain pose, Parvatasana. Breathe out, right foot comes in the front, all the pressure comes into the right knee, chest opens up, you look high up, Asana, horse riding pose. Breathe out, right foot comes together, hand is both sides, head touching your knee. Breathe out, hand goes all the way to the back, Hasta Uttanasana, and breathe in, hand comes in the front as Pranayama. 12 steps, started with breathing out, we end in breathing in, and you will do the
Next set, opposite breathing with the opposite leg. Let me show you one more time. This time you'll do breathe in, breathe out, hand goes all the way to the back, Hasta Uttanasana. Breathe in again, do a supported forward bend for a yoga therapy practice. Slowly it will come down, then your head will come and touch your knee. Breathe out, is the left foot goes to the back, right knee is in the front, chest opens up, look high up. Right foot goes to the back, heel on the ground, you look at your belly button. Here you breathe in, breathe out, your knee goes to the mat, chin goes to the mat, your whole body is in the mat. Ashtanga Namaskar. Breathe in, get up into the cobra pose. Breathe out, go back to the mountain pose. Heel on the ground, look at your belly button. Breathe in, left foot comes in the front, pressure goes to the left knee, chest opens up, you look high up. Breathe out, right foot comes in the front, hand on both the sides, head touching the knee. Breathe in, hand goes all the way to the back, and breathe out, hand is in the front. We balance this with the moon salutation, Chandra Namaskar, and you take out all the hitting poses. Put your hands in the front, you breathe out. Breathe in, hand goes all the way to the back, Hastottanasana. And slowly breathe out. Again, do a supported forward bend, hands touching your thighs and the leg, and you slowly sit down on your feet. Breathe out, right foot goes to the back, knee on the ground. Breathe in, both the hand goes high up. Breathe out, hands are in the front, left knee on the back. Breathe in, both the hand goes high up. Breathe out, you come down like a child's pose on the mat. Breathe in, you get up into a cobra pose. Breathe out, go back to the child's pose. Breathe in, both the hand goes high up. Breathe out, left foot comes in the front, hand on the side. Breathe in, both the hand goes high up. Breathe out, hands on the both side, right foot comes and both the hands on the side. Breathe in, hand goes all the way to the back. Breathe out, hand comes in the front. Now we'll do the sitting down asanas, and slowly we'll sit down in the mat in the Vajrasana. When you sit down in a Vajrasana, or thunderbolt, like here. You sit down on your heel and keep your spine straight. Supports your spine, supports your head. It really puts a lot of relaxation in your body and mind. It also increases the Agni, the fire in your stomach. We call Jathar Agni. It helps in digesting your food. And slowly you learn how to sit down on this pose in between your feet and touching your ground. Then in the empty stomach, The daily practice for asana is called Mandukasana, frog pose. You do the yogic fist, put your thumb inside and close. Bring it to the level of your belly button. Take a deep breath in. When you breathe out, and slowly look forward and start coming down. But again, keep on doing your breathing. Yogic breathing, breathing out longer than breathing in. Slowly and slowly, you listen to your body's signal. If there is no pain, if you can breathe effortlessly, like me, I'm doing the talking, I'm doing effortless breathing. See if my head comes all the way down. And when it touches the ground, I like to stay here at least 5 to 10 breaths, doing completely effortless breathing. Breathing out longer than breathing in. This is very good for people with diabetes and people with obesity. Truncal obesity. Slowly get up. When you get up, you said get up with one vertebra at a time. Take your time and come back in the Vajrasana, sitting pose. We say waist control, not the weight control. Obesity is all here. The truncal obesity, if we can control the truncal obesity, we control all of our lifestyle related disorders like diabetes, hypertension, heart disease, and high cholesterol. To quiet down your mind, Shashanka Asana, rabbit pose. Rabbit runs a lot, then quiets down. So in rabbit pose, you take your hands way high up and put the hands as far as it goes. Touch your elbow to the ground, then put your head down and stay here. Very good for anxiety, for stress disorder. Anytime you need to quiet down your mind, get into Shashankasana, rabbit pose. Control your breathing, breathing out longer than breathing in, and then again slowly get up, hand all the way high up and to your side. Next you do Gomukhasana, or call it cow face. Bend your knees. Here is my left knee. Right knee goes on the top of my left knee. And you just stay relaxed. If it doesn't come here initially, wherever it comes, stay here. Continue your breathing. Breathing out longer than breathing in. Slowly and slowly, this is going to take place. Once you're a little comfortable, relax the lower part. You incorporate relaxation of the upper part. Right knee is in the top, right hand goes high up, left hand comes in the middle, hand comes down, it touches, it hooks each other. We have seen it in the standing position, that both the hands are together. I'm in a profound state of relaxation. You can bring a little bit more relaxation, taking a deep breath in, and slowly dropping your head down. See if your nose touches your knee. Again, for yoga therapy practice, staying in a pose. Stay here at least 5 to 10 breaths in a daily practice. And then again, slowly go higher. Balance this pose to the opposite side. Now the other knee, right knee goes to the bottom, left knee comes on the top, and able to stay here a little longer. Left knee is in the top, left hand goes high up, right hand goes to the back, it touches, we just handshake each other. Again, take a deep breath in, slowly drop my head down, and touch my knee. We give you a lot of asana poses, but you pick up asanas that you can do a different asanas in different days.
but your practice of pranayama and the meditation remains same for a daily practice. Slowly bring your head high up. For the low back, we do Vakrasana. In Vakrasana or a twist, you put your feet in the front. The right foot comes next to your left thigh. When the right knee is in the top, right hand goes to the back. Left hand comes outside your right knee. Hand like this. Then hand can come down, touch your left knee. Take a deep breath in and slowly turn your body towards the right side, able to stay in the pose, completely relaxed, no pain, and doing your effortless breathing out longer than breathing in, and staying at least 5 to 10 breaths. It relaxes the muscles called a piriformis muscle, on which the sciatic nerve is sitting. It relaxes that muscle and gets rid of the chronic low back pain. Slowly release your left hand, drop it down, and for the balance to the opposite side. Take the left foot next to your right thigh. Left knee in the top, left hand goes to the back. Right hand goes outside your left knee. Hand will slowly come down, touching your right knee. Take a deep breath in and slowly turn your body to the left side. Able to stay in the pose, completely relaxed and with effortless breathing. Bring your right hand, slowly bend your knees, and then a little advanced pose called Ardha Matsyendrayanasana, half Lord of the Fish pose. Take your right foot next to your left knee. Right knee is in the top, right hand goes to the back. Your left hand goes outside your right knee, then goes and holds your feet. Take a deep breath in and turn your body to the right side. Again, come back and do the opposite side. For your daily practice, be sure you stay in the pose little longer. Again, here, right knee is on the ground, left foot comes next to your right knee. Left knee is in the top, left hand goes to the back. Right elbow comes outside your left knee, slowly comes back, touches your feet. Take a deep breath in and turn your body to the left side. Again, stay here with a effortless breathing out longer than breathing in. Release your right hand. Put both the hands on the sides. Get up into a Vajrasana, thunderbolt, and slowly lay down on your face down on the mat to do the face down poses. Backbends on the mat. This is a supported backbend, very good for chronic low back pain. First one is a Makarasana, crocodile, or you call it TV viewing pose. You put your face on the hands with the elbows together and just keep breathing out longer than breathing in. You can bend your knees, coordinating with your breathing. You breathe in with both the feet down, breathe out. Just bend your knees and bring close to your hips. You breathe in
and then breathe out. Next is your Bhujangasana, Cobra pose. Try to find the level, how far you can do on yoga therapy. Put one hand in the top and the other. Slowly get up and see how far you can get up and stay in this pose with your effortless breathing. Once you find the spot, you go for a Bhujangasana or a Cobra pose. The hands on both the sides. Take a deep breath in and slowly get up into the Cobra pose and able to stay here without any pain and effortless breathing. Very good for your chronic low back pain. We progress a little bit more, called Tirjak Bhujangasana, oblique Cobra pose. Separate your feet up to the width of the mat. You get up into a Cobra pose and look over your left shoulder towards your right foot. Slowly come down again and to the opposite side. To the Cobra pose, Bhujangasana, look over your right shoulder towards your left foot. This is also one of the asanas for Shankha Prakshalan or intestinal cleansing. Locust Shalabhasana, put your hands under your thighs. Slowly raise your both the feet high up. Keep your knees straight and able to stay here with the effortless breathing. Then you slowly come down. Finally is a Dhanurasana or a bow pose. You hold on to both of your feet and body goes high up in the shape of a bow. 4 asanas with the face down, which is very good to improve your health of your spine. Drop your body down. Put your hands one off the top. Head on one side. Just take some deep breath, breathing out longer than breathing in. Turn your head on the opposite side and see which side you feel better. To balance your body, you should stay a little longer than the side you don't feel good. Once you finish these asanas with your face down, then slowly turn around and on the mat, supine position, face looking at the sky. Laying down, first you do Savasana, corpse pose. This is a very relaxing asana. You separate your feet up to the width of the mat. Put your hands on both sides, palm facing high up. Close your eyes and visualize your breath. Visualize your breath coming in. Visualize your breath coming out, and slowly your mind and body gets connected and you get relaxed. In a yoga therapy asana practice, we do not do any counter poses, we do not do any savasana, because every asana is a relaxation. Every asana is a savasana. From here, we start doing some asanas on the laying down supine poses. First, Pavan Muktasana or knee chest. Bend both of your knees. Bring the knees close to your chest. raise your head high up, touch your nose to the knee, and slowly your chin comes in front of your knee. Able to stay in the pose without any pain and effortless breathing. Slowly you can roll side to side to make your back more flexible. You can also roll front and back, all the way down, all the way down, all the way down, all the way down. Next asana, Markadasana, monkey pose, or other name is called Jathar Parivartanasana. Put your hands on both sides like a T. Look into your right hand, drop both the knees to the other side, and able to stay in this pose. Close your eyes and breathe effortlessly, breathing out longer than breathing in. When you can do these poses completely effortlessly, you are healthy. Other name of this, Merudanda Sanchalanasana. Again, come back slowly in the midline. Look into your left hand and drop your other two knees on the right side. Stay in this pose at least 5 to 10 breaths. Very good to relax your back and the sides. And we recommend this for a daily practice. You can do a little bit more stretching. You can raise one leg high up. You drop it down, touch the right foot to the left hand, and turn your head to the right side. Same thing you can do on the other side. You can raise your left foot high up, drop it down, touch the left foot to the right hand, and you look at your left hand. Come back up. Next one you do, bridge pose, Setu Bandha Sarvanga Asana. Bend your knees up to the width of the shoulder, touching your hand to the ankle, and then slowly raise your body high up and support your hands on the mat. Your body weight will be on your feet and on your shoulder. Once you can stay here with your effortless breathing, you can raise your one foot high up and to see if you can stabilize yourself. You can drop that foot and raise your other foot high up. Then slowly drop your body down again, called one vertebra at a time. Have your both the feet straight. You can do your yogic sit-ups. Get up without a support. Do it a couple of times with your hands in front. Then you can put your hands behind your head. Then you get up. You use your core muscles, and this gives you a better sit-ups. From here you can do seated forward bend, Paschimuttanasana. Take the hands way high up, all the way down, hold on to your big toes. Face high up, keep on breathing out longer than breathing in, and the whole body will come down, and slowly the head will touch your knee. Once you come to this position, stay here and keep on doing your yogic breathing, at least 5 to 10 breaths. You get up slowly, one step at a time. For a person who's practicing for a little longer time, we'll do inversion poses. We like to do Sarvanga Asana, the shoulder stand. We'll do a Padmasana, lotus pose on a shoulder stand. Then we'll do a plow or a halasana. In a Sarvanga Asana shoulder stand, put your body all the way high up and do with a chin lock. With a chin lock and body way high up. Then slowly you do a lotus pose, Padmasana on a Sarvanga Asana. From here, you can go back to Halasana or a plow. In a Halasana, you are completely relaxed. You put your hands all the way to the back. You are doing completely effortless breathing. And stay here until your breath will allow. This is a profound relaxation which lets you get into Halasana plow pose. Stay here. When you get completely relaxed and slowly get up from the Halasana and come back to your neutral position or your Savasana. The most powerful relaxer of your body and mind is your Shirshasana or a headstand. In a headstand, when you put your head down, the pressure inside the brain goes high up, pressure inside the eye goes up, pressure inside the carotid artery goes up. You feel miserable, cannot talk. But if you keep your head down for a little longer and longer, the baroreceptors became more sensitive. The intracranial pressure inside the head comes down. Intraocular pressure inside the eye comes down. Your pressure on the carotid arteries, pressure on the leg arteries, all the pressure normalizes. When all the pressure normalizes, body will allow for a head down, feet high up. You start with a Vajrasana, then put your hands together like this. This is your stance. Then put it on your mat and then clasp your hand and put your head down. Initially, you feel that you cannot breathe, you cannot talk, but slowly and slowly your breathing gets effortless. When the breathing gets effortless, it will take few weeks. Get your body high up and keep walking towards your head. When you keep on walking, your body starts to go high up on its own. Slowly and slowly it will go high up, and you let the body to go up on its own. You do not do any maneuver, and once the body goes high up, it will stay in this area, and you'll be doing your normal effortless breathing. Pressure inside the leg, pressure inside the neck, pressure inside the head will be normal. Then slowly you come down and feel the effect of headstand in your body and mind. What happens normally, you see the world right side up, and that is the picture your brain has. When you are in a headstand, you are looking at the world upside down. Your brain sees the signal which they have never seen before. So brain becomes more active. Brain and mind start to function. And we say, in your headstand, all your creativity starts. Your blood pressure comes down because of baroreceptor sensitivity, and the body doesn't respond when there is a sudden rise in the heart rate, sudden rise in the blood pressure. We know today that acute cardiac event like rupture of the plaque in coronary arteries takes place because sudden rise in the blood pressure, sudden rise of heart rate. Able to practice headstand will protect you from sudden changes in your hemodynamics or heart rate or blood pressure. We are ready now to start our pranayama practice, the breathing exercise, which we'll be doing a set of pranayamas and 10 minutes of meditation. In a normal 1 hour of practice, we'll do 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. We did more asanas, so for a daily practice, you can do different asanas on the different day, but you should do the same set of pranayamas and meditation. Next practice is pranayama, breathing exercise. Prana is a subtle energy, life force, which keeps us conscious, keeps us alive. Yam is a control and restrain. We learn how to control and restrain our life force. Breath is the connector between your body and mind, and breath takes you to the state of meditation. Meditation is a state where we get all the effects of yoga therapy. In the breathing, the first component of pranayama is able to lower the breathing rate. Normally, we breathe 15 to 16 breaths per minute. We can easily breathe 2 seconds in, 4 seconds out. Our breathing rate will drop down to 10. The muscles which controls our breathing are skeletal muscles. They can be trained. Slowly and slowly we can breathe 3 seconds in, 6 seconds out, 4 seconds in, 8 seconds out. Our breathing rate will come down to 6 or 7 per minute. Then increasing the amount of air we breathe in, tidal volume, normal is 500 cc. When you are relaxed, the amount of air we breathe in and out is lot more than the normal tidal volume. Third, able to hold your breath. Breath holding in inhalation, breath holding in exhalation. Longer and longer we can hold the breath, better and better our health going to be. Finally, alternate nostril breathing. When you continue alternate nostril breathing, we exercise both half of our brain, we bring the balance back, and balance of body, mind and spirit is health. The first pranayama is called Bhastrika Bellows. In a normal breathing, inhalation is active, exhalation is passive. In Bhastrika, we have active inhalation and active exhalation. Normally, person who comes with multiple medical problem, we let them do a gentle Bhastrika pranayama. They will breathe out first, take a deep breath in, then actively breathe out. Let them continue the breathing until there is an effort. The effort, they stop. If they can continue, the target will be doing this pranayama between 3 to 5 minutes. Pranayama should be done with a vidhi called method, samay called timing, sankalpa or determination, and siddhi is the attainment. Once you can do the Bhastrika pranayama, we start doing a little bit of a forceful breathing, like a yogic breathing. Start raising your hands high up first and push your hand a little behind to open your chest. We breathe in. During breathing out, we do yogic fist, thumb inside and slowly drop it down, breathing out. We keep on doing it again as long as we can with the effortless breathing. Then you progress a little further. Raise your hands high up, breathe in actively, breathing out, pull it down with your yogic fist. We'll do it 3 different speed, in a very slow speed, medium speed, and a rapid speed. First, to a slow speed like this, we breathe in. Then you do in a sequence called Ishwar, Ishwar, Ishwar. Then you go to a speed called Soham, Soham, at a medium speed. Then we go a little faster speed called Vishnu, Vishnu. We keep on doing it again effortlessly, but our goal and target is between 3 to 5 minutes. At this point, we develop symptoms of hyperventilation, develop an altered sense of consciousness, a little bit of saliva in your mouth, a circumoral numbness, carpopedal spasm in your hands and feet. This is due to hyperventilation. Now my lung is empty because the 3.5 liter of the residual air is coming out. I can take a deep breath in. I can take a deep breath out. This is the beginning or gateway of pranayama. Very good for people with lung disease, asthma, COPD, pulmonary fibrosis. Next pranayama is called Kapalbhati pranayama, a breath of fire. Kapal is the forehead, Bhati is the shining. We have our abdomen here, then there is a diaphragm, and there is the lung. The 2 balloons, we squeeze the abdomen in so air comes out from your lung. All the residual toxic carbon dioxide comes out. This is called the breath for detoxification. All the toxin gets removed. It also ignites the fire, Agni. This is called Agni Pradhan Pranayama. It ignites my Agni. The first one, the Bhastrika, that is called Prano Pradhan Pranayama. It brings the prana in our life. This is called Agni Pradhan Pranayama. Technique is again, keep your spine straight, touch your index finger and a thumb. You can do with your eyes closed and bring your awareness to your belly button. Squeeze your belly button towards your spine and the air will come out. Somebody new to practice, you can put your hand in your abdomen, you can put your other hand under your nose. So when you squeeze your abdomen, air comes out. Your awareness is only in the belly button. You are not breathing. This is opposite of normal breathing. Active exhalation, passive inhalation. The day I was born, I took a deep breath in. Nobody taught me how to breathe in. So when I'm breathing out, I'm breathing in between without knowing. So all the carbon dioxide getting removed and oxygen is coming in. Also do this pranayama with mudras, hand gestures, which you call a health in your hand. This is a mudra called a dhanu mudra. Touch your index finger and a thumb, quiets down your mind, called meditation mudra, and you do the Kapalbhati pranayama. This quiets down your pitta. Pitta is the dosha, body type, also quiets down your mind. Next mudra is put your index finger down, put your thumb in the top. And again, keep doing this. Slow speed, 1 per second. And in a mudra, you hold it at least for 30 seconds to a minute. This is called Vayu Mudra. This is for your back pain, knee pain, hip pain, and neurological disorders like stroke, Parkinson's disease, multiple sclerosis. Touch your middle finger and thumb. This is called a Shunya Mudra. This improves your hearing. In your daily practice, we'll be doing a little longer this breathing in the mudra, but doing completely effortlessly. Touch your ring finger and thumb. This is called Prithvi Mudra. This is for your obesity and diabetes. Touch your little finger and thumb, called Varun Mudra. It improves your bladder function. If you cannot go to the bathroom to empty your bladder, you press your little finger. It controls your bladder. For a man, it also controls your prostate gland. People with prostate problem, let them do this pranayama with this mudra, Varun Mudra. This Kapalbhati pranayama also massages all the internal organs. Massages my liver, massages my stomach, massages my spleen, massages my pancreas, massages my kidneys, massages my prostate gland, massages my bladder. For a female, massages your ovaries, massages your fallopian tubes, massages your uterus. It helps even an infertile couple, massaging ovaries, fallopian tube, and uterus for pregnancy. If you touch your little finger, ring finger, and thumb, this is called Shakti Mudra. Prana Mudra increases your strength and vitality. Middle finger, ring finger and thumb, apana mudra, pachan mudra. It helps in elimination, proper digestion, removes any excess fat, excess sugar, excess cholesterol, excess uric acid. I always recommend you to do this mudra. If you bring your index finger down, this is called apana vayu mudra, also called a hriday mudra. This is to improve your functions of the heart. If you are having any issues with the heart, do this hriday mudra. Linga mudra, put your hands together, put your thumbs high up. Improves your body heat. Very good for people with nasal congestion, removing your phlegma. Other mudras which opens up your lung. The same mudra, which is called a dhyana mudra. If you turn your hands down, this is called a chin mudra. This helps opening the lower part of the lung. If you bend the other fingers, called chinmayi mudra, it helps opening the middle part of the lung. And if you put the thumb inside and close, called adhi mudra, it helps opening upper part of the lung. Try to do it. Your target will be between 5 to 10 minutes. People with diabetes will do it a little longer, about 15 minutes. People with cancer will do it longer. In Yogic and Ayurvedic tradition, cancer is regarded as a manda agni, low agni in sapta dhatu, 7 tissues. There is a low fire in cancer. We ignite the Jathar Agni with this pranayama. Once we relax, we do Bajra Pranayama or called abdominal lock. What we need to do, we need to show the abdomen and how to do the abdominal locks and all the chin locks. The abdominal locks, what you do, you will be breathing out first, then you will be breathing in, breathe out, then suck your stomach in and hold, then touch your chin to the chest, chin lock, contract all the pelvic muscles, pull it up and hold it. So let me show you one time how to do it. You breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach and hold. This increases the negative intra-abdominal pressure. It helps perfusion of the intra-abdominal organs. Chin lock touches the chin, massages the carotid sinuses, it lowers the heart rate. This is a very powerful practice to cleanse your physical body and mind. We can do next technique is called Agnisar Kriya. In Agnisar Kriya, you will be doing like your abdominal lock called Udyani Bandh, chin lock is called Jalandhar Bandh, and root lock is called Mula Bandh. Here you do the Uddiyani Bandh, then move your abdomen to massage all the intra-abdominal organs. When you do all the three together, it is called your Mahabandh. So you breathe out first. Take a deep breath in. Completely breathe out. So move your abdomen back and forth. That is called Agni Sarkriya. Let me show you one more time how to do it. So you breathe out first. Take a deep breath in. Completely breathe out. These are the practices for your physical body. From physical body, go back to your mind. Your mind quiets down with alternate nostril breathing and Bhramri Pranayama, the Bumblebee breathing. The transitional breathing is called Ujjayi Pranayama. Ujjayi is the victorious breath. We call it a resistive inhalation. Try to breathe in with a closed larynx like this. In a Ujjayi Pranayama, you can do it also very gently. Just it's a relaxation of the laryngeal muscles. Laryngeal muscle is supplied by your superior and inferior laryngeal nerve, or a branch of vagus nerve. The impulse from the nerve goes up to your brainstem, and for the vagus nerve, most of these signals are afferent, going to the brain. From the brain, the signal comes back through your glossopharyngeal nerve. It contracts the muscle in the soft palate, palatopharyngeus muscle, and cures your snoring. It is a very good pranayama for the treatment of snoring. The impulse also comes to your hypoglossal nerve, to your tongue, pushes the tongue in front. It is a good practice for your sleep apnea. For sleep apnea, snoring, we recommend Ujjayi Pranayama or Victorious Pranayama. People who are singing, who wants to improve their voice, recommend this pranayama. For the mind, you start with alternate nostril breathing. Use your right hand. Left hand, do your Dhyana Mudra, touch your index finger and thumb. From the right hand, use your right thumb to close your right nostril. From your left nostril, first you breathe out, then you breathe in through the left nostril. Drop your hand down, close your left nostril with your ring finger and little finger, and breathe out through your right nostril. Breathe in through the right nostril. Close the right nostril. Breathe out through your left nostril. Now keep on doing alternate nostril breathing called Anulom Vilom Pranayama. Right nostril is controlled by the left brain. Left brain is analytical brain. It's heating, it's a male. Right nostril breathing is heating, called Suranari, sun energy, or it's called a sympathetic tone. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is cooling. Right brain is female. Left nostril breathing is called Chandra Nari or moon energy. This exercises both half of your brain. Very good to improve your memory. People with dementia, people with Alzheimer's disease. This also balances heating and cooling energy of your body. In yogic tradition, left side of our body has a female energy, right side has a male energy. It balances both half of your energies. This is the first pranayama we recommend for people with hypertension, high blood pressure. Recommend for people with neuropsychiatric disorders. This is also called a Vayu Pradhan Pranayama. Balances Vata dosha, which then controls our Pitta dosha. Very good for people with heart disease, atrial fibrillation, coronary artery disease. Continue it with completely effortlessly. Our target will be between 5 to 10 minutes out of 25 minutes. When you become little better on alternate nostril breathing, we do called Nadi Shuddhi Pranayam with a breath holding with alternate nostril breathing. Use my hand, drop my index and middle finger down and make a pinch called Vishnu Mudra. I'll put it over my nose, I will close my right nostril, I'll breathe in through the left nostril with a count of 4 in, like a 4 seconds. I'll hold the breath for count of 16 seconds with a chin lock, and will breathe out with a count of 8, like 8 seconds with a ratio of 1:4:2. And we'll do it again from the other side. So let's show it to you. First, you close your right nostril, breathe out through the left nostril, breathe in through the left nostril with a count of 4 in. Hold your breath for count of 16 with a chin lock. Breathe out through the right nostril with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath with a count of 16 with chin lock. Breathe out through the left nostril with a count of 8 out. This opens up your channels in the body, very good for people with asthma, people with coronary artery disease, and when you become more comfortable, you can increase the breath holding. Like now, it can be count of 5 in, 20 holding, 10 out. This quiets down your mind to the point you go to the next pranayama called Bhramri pranayama or a bumblebee breathing. Our 5 senses keeps us awake, alert. When we can control our 5 senses called pratyahara, quiet down our mind. We'll shut down our 5 senses, we'll create a vibration. Again, that vibration will cancel the vibration of the brain and will enter into a profound state of relaxation. Start with putting our index finger in the forehead. Use the 3 fingers to close the eyes. Use the thumb to close the ear and then close my mouth. So shut down my vision, shut down my hearing and my smell and the taste. I'll breathe out first, take a deep breath in and breathe out with the sound of a bee. This totally quiets down your mind and is very essential pranayama for insomnia. If you cannot sleep, you do this pranayama, within a short time you will fall to sleep. May not happen in the first day, may not happen in the first week, but this will happen if you practice it. Normally for a daily practice, we ask you to do between 5 to 10 times. Resistive exhalation called Shankha Pranayama. We breathe through our nose and breathe out through our nose. We do not breathe through our mouth. Mouth is given just for eating and talking. If you breathe in through your mouth, you don't know where the air has gone. It has gone to the stomach, gone to the lung. If you have to breathe through your nose or have to breathe through your mouth, you can breathe in through your nose, you breathe out through your mouth. This is more physiological. We use the same technique that's called Shankha Pranayama or a conch shell breathing. We use our yogic fist, we put one on the top in the another one. Breathe in through the nose, breathe out through your mouth, we pucker our mouth as if we are blowing a conch shell against resistance. Keep on breathing as long as we can, and generally for a daily practice we'll do 3 to 5 times to improve our power of breathing so we can inhale a large amount of air with the daily practice. Finally, we have cooling pranayama called Sitali pranayama. It cools down inside our body. Again, we breathe in through your mouth, not to get the air in, but to cool down inner body temperature. Roll your tongue out. Breathe in through your mouth with the rolled tongue. Close your mouth, hold it for a few seconds, and breathe out through your nose. If you cannot roll your tongue, you can breathe through your teeth, called Sitkari pranayama. When you do your whole yoga practice with your eyes closed, you get a better and better relaxation. We'll finish our practice with a Yoga Nidra and meditation, and we'll finish with Singhasana and a Hassasana, lion pose and a laughter yoga. Yoga Nidra. This is relaxation. Lot more relaxation than Savasana. Here, you lay down, separate your feet, the width of your mat, hands on both sides, palm facing high up, receiving all the divinity coming to you. Eyes are closed. Again, you visualize the breath. Visualize the breath coming in through your nose, behind your throat, going down to your chest. And breath is coming out same way it was going in. By able to visualize your breath, quiets down your mind. You bring the relaxation in your body. First you bring called instant relaxation technique. Take a deep breath in and hold. Contract all the muscles of the body and just let go. Breathe out first. Take a deep breath in. Hold the breath. Feel a profound sense of relaxation. Next is a quick relaxation technique through your abdominal breathing. Put your hand on your abdomen. When you breathe in, your abdominal wall goes high up. Breathe out, abdominal wall goes in. So breathe in, breathe out. This is the same breathing you'll see the babies. The babies, when they're sleeping, the whole abdomen goes high up, abdomen comes down. Diaphragmatic breathing, abdominal breathing. Keep on doing it with your eyes closed. And very shortly, you'll enter into a profound level of relaxation called quick relaxation technique. Deep relaxation technique, you start relaxing one part of your body at a time. Bring your awareness to your toes. Relax your toes. Relax your feet. Relax your leg.
relax your thighs. When the part of your body is relaxed, you don't even feel that part even belongs to you. You let go. Relax your hip areas. Relax your abdomen, chest, head and neck. Head and neck is the tightest part when you are in stress. Two muscles in the head and neck area. One on the side of your neck, trapezius muscle, supplied by spinal accessory nerve. Another muscle on the side of the neck, sternocleidomastoid muscle, turning your head on one side. That also supplied by a cranial nerve. So two muscles are supplied with the nerves coming from inside the brain. When you learn how to relax them, you relax your brain and the mind. Relax your tongue. Relax your jaws. Relax all the muscles on your face, muscles in your forehead, all the muscles in the face and the forehead that attach to the skin. When they relax, the wrinkles in the face goes away. When they relax, the lines in the forehead goes away. It's a profound relaxation of your whole body. You enter into a subtle body. This is your gross body, sthula sharir. You enter into the subtle body called shukha sharir. You learn how to control your five senses. You focus in your third eye. Focus on a flame of a candle. Focus on a blue sky. Focus on a blue ocean, or tip of a mountain. Slowly and slowly your focus goes away. You enter into a state of meditation. Completely relax. Don't try to get up. Slowly turn your body towards one side. Bend your knees in a fetal position. Put your head on a folded hand. Wait for a few minutes or few moments. Then slowly get up and sit down in your cross-legged position for meditation practice. Meditation quiets down your mind. Mind is the content of your five senses. All the information we receive through our five senses, if we can tame our five senses, quiet down our mind. Silence is the best way to quiet down all the five senses. In yogic tradition, the vibration, which has the same frequency as of your brain, also quiets down your five senses. So two meditation which is recommended. First one is the Om meditation. We'll do 3 Om sound, again with the 3 component of Om, A, U, Ma, A, U, M, coming from the lower lung, middle lung and upper lung. Then we'll finish with Chakra awakening meditation. So 3 Om Pranayama. First, you breathe out. Take a deep breath in.
When the yogis close their eyes, they start looking inside. They first started looking all the lights. They have looked at the lights of the rainbows, 7 lights, violet, indigo, blue, green, yellow, orange, red. They assign those lights in same sequence from the top of the head to the root of the spine as the color of the chakras. Chakras are like the site of energies or a power. They are present in the subtle body, and in relation to the gross body, they are connected to plexuses like sacral plexus, solar plexus, cardiac plexus. They're connected to endocrine glands, but they're dormant. They need to be open for the energy to be released. Yoga gave us the vibration of the sounds for the 7 chakras, called Chakra Awakening Meditation. Bring your awareness to the root of the spine. Visualize a red chakra or a red wheel. It has 4 sides connected to musculoskeletal system. Function is the power. And the sound to awaken the chakra is the lum. So we'll breathe out first, we'll breathe in and breathe out with the sound of a lum. Then we'll continue the sounds for every chakras in the same sequence. Lam. Bring your awareness in the pelvis, between the belly button and the root of the spine. Pelvic chakra, Shadhisthana chakra, connected to reproductive system. Function is procreation. Color is orange. It has 6 petals, and the sound to awaken is Vam. Vam. Third chakra, solar plexus chakra, Manipur chakra, connected to gastrointestinal system. Function is to control. Color is yellow. It has 10 petals, 10 sides. Sound to awaken is Ram. So breathe out first. Ram. Fourth chakra, Anahata chakra, heart chakra, at the level of your heart. The color is green. It has 12 sides or 12 petals connected to cardiovascular system, and the function is love. The sound to awaken is yum. Yum. Fifth chakra, throat chakra, Vishuddha chakra. Color is blue. 16 petals connected to respiratory system. Function is communication. Sound to awaken is hum. Hum. Sixth chakra, Agga chakra, third eye chakra. Color is indigo. 2 petals connected through endocrine system. Function is intuition. Sound here is sham. Sham. Seventh chakra, Sahasra chakra, crown chakra. Color is violet. 1000 petals connected to nervous system. Function is bliss. Sound to awaken the chakra is Om. Om. Bring my hands in front of my chest. Then I keep my little finger and thumb together, open my other fingers. This is called Padma Mudra, Lotus Mudra. Receives all the divinity. Yoga therapy provides us wellness, physical, mental, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness brings all the healing. Healing also takes place through your heart. Heart is connected through your soul. Heart is your mind. We say all the time, memorized by heart. I bring that Padma Mudra close to my heart, that all the mental and spiritual healing comes to my heart, heals up my body, mind and spirit, makes me healthy and disease-free. Bring my hands together and I say Namaste. I honor the divinity within you. This will be your end of practice yoga therapy for health and healing. After 1 hour of yoga therapy practice, which is a relaxation response, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation, we still have some tension inside us. Yoga gave us 2 asanas, Singhasana, lion pose, and Hasasana, laughter yoga. We can do all at the end of our practice to get rid of all the tension. So sit down in a Vajrasana, slowly put your hands in the front, separate your knees, you'll stick your tongue out, roll your eyes high up and roar like a lion. We'll do it 5 times and then followed by laughter yoga or hasasana. Thank you.